Hello, my name is Madhura Gauri Shevde. I am a respiratory therapist and a program coordinator at Chest Research Foundation. Today, we are going to learn about the different techniques of using inhaler devices. The technique of using inhalers is extremely important for the patient and their disease. If the technique is not done correctly, the drug does not go into the desired parts of the lungs, and therefore there is no effect on the lungs and the disease. Hence, we should ensure that each step is done correctly by our patients. The first device that we are going to know about today is a pressurized meter dose inhaler. Before we begin using a pressurized meter dose inhaler, it is extremely important to prime. Now, what is priming? Priming is a step that is needed to make sure that the dosing chamber of the meter dose inhaler is filled completely with the desired dosage or the desired amount of the drug. Patients will need to prime their MDI the first time that they buy and open it, or if it hasn't been used for several weeks. Now, how do you prime an inhaler? It's very simple. You remove the cap of your inhaler, you shake your inhaler, and you ensure that the mouthpiece is away from your face or the patient's face. You spray it in the air for 2 or 3 times. This is priming. The first step of using your inhaler is simple. You remove the cap, you shake your inhaler. Why do you shake your inhaler? This is a canister that is present in all of your meter dose inhalers. This canister contains drug. It contains a surfactant that reduces the surface tension inside the canister. You have a propellant that allows the drug to come out in an aerosolized format, and you've got other compounds. When you shake your inhaler, you ensure that all of this is mixed properly and the dose that is delivered to the patient is the appropriate dose. Once you are done shaking your inhaler, the next step is to breathe out gently and deeply, ensuring that the patient exhales out completely. Now, why do you need to exhale out completely? If you do not exhale completely, when you start inhaling, you are not able to take a deep breath. Thereby, the drug is not reaching the desired parts of the lungs. Only a little amount of drug goes in. Whereas, if the patient exhales completely, during inhalation, the patient is able to take a deeper breath in that allows the particles to reach the lower part of the lungs. Once the patient exhales completely, the next step is to place the mouthpiece between the teeth, sealing it with the lips. This ensures that once you actuate, your drug doesn't escape from the corners of the lips or from the top portion of your canister. So, like this. So, the first step, you open the mouthpiece and you shake your MDI. You exhale completely. You place this between your teeth and you start inhaling, or you actuate. Now, how do you do that? You should actuate the canister once you have already started inhalation. So, there has to be a proper coordination between your actuation and inspiration. So, you start inhaling and then you actuate. Once you actuate, you should take in a slow, deep breath in. It is very important to take a slow breath in so that the drug particles reach the lower part of your airway. So, 2 important things: coordination between your inspiration and actuation. You begin inspiration and then actuate, and take a slow, deep breath in. Once you inhale, you must hold your breath for 10 seconds. Now, why do you need to hold your breath for 10 seconds? The smallest particles, which are extremely light, they tend to take a very slow time to reach the bottom or the smaller part of your or the smaller airways. To allow that, you hold your breath for 10 seconds. Once you are done holding the breath for 10 seconds, you exhale out slowly but through your nose. How to use an MDI alone? After using an MDI or any inhaler device, you must ensure that the patient gargles, not drinks water but really gargles and spits it out. That is essential so that the side effects of the drug when it sticks to the throat are minimized and the infection that it may cause the patient is also avoided. The next is going to be using meter dose inhaler with a spacer attachment and a mask attachment. Now this is a spacer. The first step is to assemble your spacer, whichever brand it may need assembly. So you may have something looking like this, or you may have something looking like this. Ensure that it is ready for use. Once it is ready, you shake your inhaler, remove the cap, shake the inhaler, and you attach it to your spacer. Then the steps are similar to your MDI. You breathe out gently, completely. You place the mouthpiece of your spacer between your teeth, seal it with lips. Once you're done that, you actuate your canister and begin inspiration, inhaling slowly and deeply. You hold your breath for 10 seconds. Once you are done holding your breath for 10 seconds, you exhale slowly back through the nose. If you exhale everything through your mouth, the particles that are still settling down tend to come out, and you want the medicine to have an effect on your lungs. As I said before, once the steps are done, ensure that the patient gargles so that the particles that are stuck to the at the back of the throat, they are washed off. So let me demonstrate the use of your MDI with the spacer once. So that was your MDI with spacer. Now, as I said, you can use this for children up to the age of 6 who are not able to do all of these steps of holding, breath hold and exhaling through the nose. What do you do for them? You let them do a slow and deep tidal breath within the device, like so. Since there is a valve here, this valve does not allow the air to go back into the device, thereby allowing the patient to be able to do tidal breaths. There is a population that maybe does not have teeth or are not able to hold this between their teeth. They may be old or they may be extremely young. For such patients, we have an attachment of a mask that can go on to your spacer. The combination of an MDI and spacer is recommended by guidelines, by authorities. Why? A spacer, typically which is available in the market nowadays, is made with a zero static material that does not allow the drug particles to stick to it, thus ensuring that a more amount of drug is deposited in the patient's lungs. Also, the side effects that you see with the use of an MDI are reduced to a greater extent when you use it with your spacer. Also, when you use spacer, the patients are able to better coordinate when they use this combination versus just using the MDI alone. And of course, a lot of studies have shown that usage of spacer has better deposition, as I already said, into all parts of the lungs as opposed to just the back of the throat. That is why using your MDI with a spacer is the best idea. Now moving on to using MDI with spacer and a mask. MDI spacer with a mask can be used by children, can be used by babies, can also be used by geriatric population, or in general patients who have less teeth or are not able to put it in their mouth and seal it properly with the lips. So this is how you attach a mask to your spacer at one end and your inhaler at the other end. The steps of using this combination is just like using your MDI with the spacer. You have to ensure that the mask that you choose is of the appropriate size. There are a few different sizes available in the market. The mask that you choose should cover the bridge of the nose and your lips and should have a nice seal at the chin, like this. That ensures that the drug does not escape from the parts, especially the indentations or the different structures of cheekbones. So this is your MDI with spacer and a mask. Now how do you clean and maintain all your devices? For your MDI, since the latest MDIs come with a dose counter, it is not advisable to wash it under water. It is advisable to wipe the mouthpiece with a piece of cloth or tissue, and you can place it, or at the most with a little bit of moist cloth that cleans out the lipstick or the saliva. With your spacer, you should allow your spacer to be run under tap water, and once that is done, you should keep it in a cool, dry shade, allowing it to air dry. Ensure that you do not use any detergents, scrubs, or you boil this in water. Why? Because the non-static or the zero static, that's what the device is about, that goes away, and the next dose that you use, all the medicine sticks to your device. It's advisable that you follow the cleaning methods that are recommended by the manufacturer. They may be slightly different depending on the brand that you use, but overall this is what you should do. Now let's move on to the next device. Our next device is the dry powder inhaler. There are various types of dry powder inhalers available in the market. You have a single dose inhaler wherein you put one dose at a time and the patient actuates or inhales. And you got your multiple dosages inhaler. That means already there are different dosages present in the device. The patient has to just get one ready or actuate one and inhale. Now let us look at the steps of using a single dose dry powder inhaler. For that, you have to ensure that you are using whichever device you are using, it's vertical. If you are using a capsule based inhaler, you have to ensure that your capsule is inserted with the transparent portion at the bottom, like so. Now for this inhaler, you have to twist it sharply. You must have heard that click. That actually split the capsule into two with the drug inside the device. For other types of devices, you may place your capsule in here, close it and pierce it like so, or you may have something like this, or you may have something like this, wherein there are needles inside. Those pierce the capsule and it's ready to use. Coming back to this device, once the capsule is broken and it's ready to use, the step is similar to your MDI. You breathe out gently, deeply. You place your inhaler between your teeth, seal it with lips, and you inhale the powder or the drug rapidly or quickly and deeply. Why do you do that? Now the drug particle which comes in a dry powder formulation, it typically is a larger molecule which is maybe a lactose molecule, to which your drug molecule is attached. When you start inhaling rapidly, that inspiratory flow, that force that is generated, it actually helps separate the two particles, the large lactose particle with your drug particle, along with the mesh that is present in the device, that completely breaks it apart and separates it. With this separation, the larger particles remain in your mouth or at the back of the throat, and the smaller particles, they go down to your different parts of the lungs to have an effect. That is why it is extremely important to have a quick deep inhalation. Once you are done inhaling, you hold your breath for 10 seconds, after which you exhale out everything through the nose, and that's it. You gargle after you are done with the steps. So let me demonstrate all the steps again to you. And that's how you use a single dose dry powder inhaler. Let us move on to understanding the different steps of using a multi-dose inhaler. So let me take an example of this inhaler where you have to twist. So you open the device like so, and you twist it sharply back and forth. You heard that click? That click means it's ready to use. Now this technique may depend or vary depending on what device you have. You may have a disc type of inhaler where you have to open, press the lever left and right to get it ready, or something like this that you twist it open, or some other devices where you actually press and one cartridge opens up and it's ready to use. So for training purposes, I'm using this. So now the dose is ready. I exhale out, breathe out gently, deeply. I have to ensure that I do not exhale into the device, because the moisture that I am exhaling will go into the device and the powder that is dry will become moist, thereby changing the size of the particle, because of which if the particle size changes, the drug doesn't go to the lower parts of the lungs. Once that is ready, I place this in my mouth, sealing it with my lips. I inhale the powder quickly and deeply like the dry powder inhaler that I showed before. I hold my breath for 10 seconds. I exhale through my nose and gargle later. So let me demonstrate all the steps again. So that's how you use a dry powder inhaler. Now how do you clean and maintain your devices? For such devices, you can run them under tap water and let it dry in a cool shady place, allowing it to air dry. If you have certain devices like these, you will have to just wipe the mouthpiece, maybe a little bit of water or just a tissue paper, and keep. It is advisable to follow the recommendations of the manufacturer. They may be different depending on the device. And you ensure that you do not boil, use detergents or any other material to wash this, as it may damage the parts and therefore reducing the effectiveness that it has while delivering the drug. So that was your dry powder inhaler.
Another type of inhaler device is the breath actuated inhaler. It is made such that it has all the advantages of a PMDI and a DPI combined, and it overcomes the disadvantages that we see when we use a PMDI alone. It helps overcome coordination issues that are commonly seen by automatically actuating the drug based on the flow rate that is generated by the patient. Also, dosages do not get wasted in this type of an inhaler. In this slide, we see different types of breath actuated devices and their different mechanisms. but all of them have similar working principles, where the device senses a change in the patient's flow and pressure during inhalation and then triggers a dose of medicine. How do you use a breath-actuated inhaler? Before we move to see the steps, please note that depending on the manufacturer, steps may slightly vary. What we will look at are the general steps that are most commonly found or done. The first step, you hold your device upright and you shake your inhaler. You push the lever up, remove the cap, depending on your device. Once the cap is removed, you breathe out gently and deeply. You place the mouthpiece between your teeth, you seal it with lips, and you start inhaling slowly and deeply. You will hear a click or a whoosh sound that indicates that the drug has been delivered. Make sure you continue to inhale slowly and deeply without any pauses. At the end of inhalation, hold your breath for 10 seconds. Exhale slowly through your nose at the end of 10 seconds. Close your cap or pull down the lever depending on the device. And in the end, don't forget to gargle with water to avoid any side effects of your medicine.
Now let us move on to the most commonly used or commonly seen type of an inhalation device. It's known as a nebulizer. A nebulizer that I am showing you here is the jet type nebulizer. As you have already seen, there are other types of nebulization devices that uses different techniques. The techniques are more or less the same. They may differ depending on the device. For learning purposes, I am going to show you your nebulizer. Now the nebulization apparatus comes with a mask. It may have a mouthpiece attachment. You have your medication cup or the chamber, and you have your oxygen tubing. So when you start nebulization, you have to assemble the apparatus. I have my medication in the Respule format here. What I do is I twist it open. I insert the medicine in the medicine cup or the nebulization chamber, ensuring that this has completely emptied here. Then I add the apparatus that I want to use, either a mask or a mouthpiece. So I attach my mouthpiece, which is ready to use. Then I attach one end of the oxygen tubing to my nebulization cup tightly so that it doesn't break off during nebulization. The other end of the oxygen tubing needs to be connected to your nebulizer. Let me just show you. So for this nebulizer, there is a small opening here that actually pushes the compressed air through the nebulizer. So that is where I attach my other end of the oxygen tubing. Now how does the nebulizer actually work? It has a compressor that is placed here that sucks in air, room air, and it pushes that room air through this nebulizer cup with a force and a flow. That flow goes through the drug, the liquid drug that you can see here, and the mixture of the air and this liquid drug then creates your aerosol particles that are then given to your patient. It's as simple as that. So you have to ensure that everything is connected well. Once you have connected all of this, you simply turn on your nebulizer from the back. It will start nebulizing. Place this mouthpiece between the teeth, seal it with your lips, or if you have your mask, you have to ensure that the mask has a correct fit like this, which captures or which is placed properly on the bridge of the nose, the edge of your lips and your chin. Everything gets covered, and then you can tighten it with this that they have given here. Once you start, you have to just inhale and exhale tidily, normally, until this drug is completely over and you start hearing a different sputter. You will realize that there is nothing, it's empty, after which you can stop the treatment. So let me just quickly show you how it looks like. So you can see that it is being aerosolized. That's it. So during inhalation, you will see that the drug is delivered to the patient. During exhalation, everything comes out. Now this whole treatment or this whole process takes about 10 to 15 minutes to completely finish, and that is the end of your treatment. So this was using a jet nebulizer. I'm going to talk about how do you disinfect and clean your nebulizer. Cleaning is simple. You just wipe off the surface of the nebulizer device with a clean cloth. Follow the recommendations of the manufacturer. With the devices that the nebulizer kit that is present, ideally should be washed after every use for every patient. You disinfect after every use. How do you disinfect? You make a 2% solution of glutaraldehyde and you soak all the equipment in it for 20 minutes, after which you rinse the parts under steady stream of water. You shake off the excess and you allow it to air dry on a paper towel or a napkin in a cool shaded place. After this is dried up, you put it in a Ziploc bag or a plastic bag so that it does not get contaminated because of the environment. There are many other ways that you can use to disinfect or clean your nebulizer. This is the most commonly used and it's very easy to do, and one must ensure that it is followed. Ideally, the kit should be thrown away after every use, but because it is not feasible economically, we reuse it and disinfect it after every use. That was how you use the technique of using different types of inhaler devices. I am sure that you've learned a great deal after watching this video. Thank you so much.